Hey there, and welcome. Today we're going to talk about something called endometriosis. It's a condition that affects literally millions of people, but it's still so often misunderstood. We're going to break down what it is, what the symptoms are, and how it's managed. So let's just dive right in.
So let's start with a question that gets right to the heart of it all. Is your period pain debilitating? I mean, so bad that it completely disrupts your life? For so many, this is the very first sign that something more might be going on than just your typical monthly cramps. So what's really the difference between normal cramps and the pain that comes with endometriosis? Well, this lays it out pretty clearly. Typical cramps, they're an uncomfortable annoyance, for sure. But endometriosis pain is often on another level entirely, severe enough to make you miss school or work or just life. It can also show up before your period even starts and stick around for days. And a lot of the time, standard pain meds just don't touch it. If any of this is sounding familiar, please know what you're experiencing is real and it's valid.
But that intense cramping is really just one piece of the puzzle. Endometriosis is actually a pretty complex condition, and it can show up with a whole range of symptoms. Let's explore what else can be part of the experience.
Pain is definitely the main event here, but it can manifest in a bunch of different ways. We're talking about pelvic pain that seems to get worse as time goes on, that nagging lower back and abdominal pain, and even pain during or after sex. It can also cause issues like pain when you go to the bathroom, which can get a lot more intense during your period.
And yeah, the list doesn't stop there. Other really common symptoms can include things like excessive bleeding. And for some people, the very first sign that something's wrong is that they're having a hard time getting pregnant. It can also bring on this whole host of other problems, like just being tired all the time, digestive issues, bloating, nausea. It can be a really confusing mix of symptoms to deal with.
Now, here's something that's actually pretty surprising and kind of counterintuitive. You'd think that more pain means a more severe case of the condition, right? But with endometriosis, that's just not always true. Someone could have just a few small patches of tissue but be in absolute agony, while someone else could have it much more widespread and feel very little pain at all.
Okay, so we've covered the symptoms, what it can feel like from the outside, but what is actually happening inside the body to cause all of this? Let's get to the core of what endometriosis really is. So here it is. At its simplest, endometriosis is a condition where tissue that's similar to the lining of your uterus, which is called the endometrium, starts to grow outside of it. This rogue tissue usually sets up shop on the ovaries, the fallopian tubes, and the tissue that lines your pelvis.
And this right here explains the central problem. This tissue, even though it's in the wrong place, it still acts like it's supposed to. So every month, it responds to your hormones. It thickens, it breaks down, and it bleeds. But here's the kicker. Unlike the actual lining of your uterus, this blood has absolutely no way to leave your body. It gets trapped, and that trapped blood irritates all the surrounding tissue, leading to inflammation, intense pain, and even the formation of scar tissue that can cause organs to stick together.
All of this leads to the big question, why? Why does this even happen in the first place? Let's take a look at what science tells us about the potential causes and risk factors.
The really frustrating answer is that scientists still aren't 100% sure what causes it, but there are several leading theories. One of the big ones is something called retrograde menstruation, which is basically where menstrual blood flows backward into the pelvic cavity instead of out of the body. Other ideas suggest that certain cells just transform into endometrial-like cells, or maybe that there's an issue with the immune system that's supposed to clear this stuff out, but doesn't. So while we don't have that one exact cause, researchers have pinpointed several factors that might increase your risk. As you can see, things like starting your period young, having really short or heavy cycles, or having higher estrogen levels can all play a role. And there's also a really strong genetic link. So if your mom, your aunt, or your sister has endometriosis, your own risk goes up significantly.
So what if you suspect you might have endometriosis? What happens next? Let's walk through what the path to getting a clear diagnosis usually looks like. And this is so crucial. The whole journey to getting answers really just starts with a conversation. The most important, most powerful first step you can take is to describe exactly what you're experiencing to a healthcare provider you trust. So the process usually kicks off with you describing your symptoms in detail. From there, your doctor might do a pelvic exam or order some imaging, like an ultrasound or an MRI. But, and this is a big one, the only way to get a 100% definitive diagnosis is through a minimally invasive surgery called a laparoscopy. That's what allows a surgeon to actually go in, see the tissue, and take a small sample to be sure. Getting that diagnosis can feel really overwhelming, but it's also the first real step toward managing the condition and getting your life back. So let's have a look at the treatment options. The key thing to know about treatment is that it's not a one-size-fits-all approach. It's really about finding the right strategy to manage your specific symptoms. It's often a layered approach, maybe starting with medications for the pain, using hormone therapies like birth control to slow down that tissue growth, and in some cases, considering surgery to actually remove the growths. The whole goal is to regain control and improve your quality of life.
Now, we do need to talk about one of the most significant complications that can come with endometriosis, and that is its impact on fertility.
And this number can be pretty jarring to see. Up to half of those with endometriosis may have a tough time getting pregnant. The condition can do things like block the fallopian tubes or just create an inflammatory environment that makes it harder for an egg or sperm to do their thing.
But, and this is a really, really important but, a diagnosis does not automatically mean you're infertile. Not at all. Many people, especially those with mild to moderate cases, are absolutely able to conceive and have healthy pregnancies. The key is just not to delay talking to your doctor if you know you want to start a family. While there's no cure right now, this is not a hopeless situation. Treatments can help you take charge of the condition and its complications. There is always a path forward. We've covered so much today, from the symptoms to the biology to the treatments. But it all really comes back to this one fundamental idea. The pain is real, your symptoms are valid, and advocating for your own health is the most critical step you can possibly take. So could it be that just listening, really listening to what your body is telling you, is the first real step toward relief? Thanks for being here.